Hello everyone, welcome to today's lecture on lymph node drainage. This is a simple but very powerful topic and I have added a plenty of images to make it as visual and memorable as possible. Without further delay, let's get started. Here, the dorsolateral aspect of the foot, the dorsum and the lateral aspect of the foot drains to the popliteal lymph nodes. For example, a classic question might be, a 41-year-old male develops an infection of the dorsolateral foot that spreads through the lymphatics. Which lymph nodes are first affected? And the answer is the popliteal lymph nodes. Which lymph nodes are first affected? And the answer is popliteal nodes. To summarize, the popliteal nodes drain the dorsolateral foot. Now let's move upward to the gonads, which follow a very different drainage pathway. The gonads drain to the para-aortic lymph nodes because they descend embryologically from the retroperitoneum. That is why testicular or the ovarian cancers metastasize to the retroperitoneal nodes, not to the superficial inguinal nodes. In contrast, the scrotal skin drains to the inguinal nodes. Now let's look at the GI tract. The forehead extends from the esophagus to the ampulla of Vater, including esophagus, stomach and the first part of the duodenum till the ampulla of Vater. The midgut spans from the ampulla of Vater to the proximal 2/3 of the transverse colon. That means it includes the duodenum, jejunum, ileum, ascending colon and proximal 2/3 of the transverse colon. The hindgut covers the distal 1/3 of the transverse colon down to the rectum. Accordingly, the foregut, which is in close proximity to the celiac nodes, is drained by the celiac nodes. The midgut is drained by the superior mesenteric artery nodes, while the hindgut drains into the inferior mesenteric nodes. The female reproductive tract. The cervix as well as the uterine body of the female reproductive tract drains to the external iliac nodes. Whereas the internal iliac nodes handle the drainage from the bladder, the rectum as well as the anal canal above the pectinate line. So, the external iliac to reinforce, external iliac nodes drain the body of the uterus and the cervix, while the internal iliac nodes drain the bladder, the rectum and the anal canal above the pectinate line. By contrast, the superficial inguinal nodes drain the anal canal, which is below the pectinate line, as well as the skin of the scrotum. A good rule of thumb is superficial inguinal lymph nodes drain the part of the body structures which are present outside the body, like the anal canal below the pectinate line and the scrotal skin, while the deep nodes, that is the external iliac and the inguinal internal iliac nodes, drain the deeper structures. The major lymphatics. Now the major lymphatic ducts. The right lymphatic duct drains the right arm, right chest, right head and neck. The thoracic duct drains the everything else, the entire left side plus both lower limbs. Both the ducts empty into the junction of the subclavian as well as the jugular veins. Since the thoracic duct is the major, drains such a large area, injury to it can result in chylothorax. Damage to the right lymphatic duct, in contrast, usually has limited effects. With this, we have come to the end of the presentation. If you like my videos, I have an entire playlist on many systems. You can browse them. If you want me to teach you, mentor you, you can send me a message in the comments. All the best for your exams or for your learning. Bye.